My name is Dr. Eric Salud. I am a general dentist, and what makes my approach to dentistry unique is that I am focused on the patient experience. I believe that if I can provide a patient with the best dental experience possible, that they'll return for more visits and routine visits so that we can prevent bigger things from happening in their mouth. Well, preventative care is what dentistry is all about. What we're what our aim is to do is to prevent by treat is to treat you before something worse happens. We want to prevent things from disease in your mouth from getting worse over time. And so what preventative treatment is coming in for your routine cleanings and x-rays and exams. And so that we can find the disease at its earliest point so that we can treat it the least invasively as possible. Regular checkups allows us to see what's exactly going on in the mouth. We're able to pinpoint disease at its earliest point. Cavities tend to Cavities and gum disease tend to not hurt very much, or tend to not cause pain. And so when we're able to detect these diseases at an early stage, we can treat them to the point where larger treatment isn't necessary in the end. Digital imaging and technology really helps with the prevention of further disease. With the advent of AI, we are able to really pinpoint and detect diseases much earlier, such as cavities and gum disease, where we can treat them at an early stage. Because the longer you wait to treat a cavity or your gum disease, the more invasive the treatment tends to be, and the less predictable it tends to be. So when we can pinpoint things at an early stage, which technology has allowed us to do, then we can really treat the disease at an early stage where it will not become a problem later on. Once you have restorative work done, such as implants and crowns, maintenance is key to the longevity of those restorations. If you don't keep up with keeping them clean and having them evaluated, then bigger problems can occur. So, with preventative care and routine checkups, we're able to monitor your existing restorations or your new restorations. And if something is going on with them, we can detect it early and fix it at an early stage before things become worse. The what's changed in dentistry is the technology that we use now. First off, local anesthetics are much more powerful than what they used to be. So the procedures themselves are not as painful. They're not as painful as they used to be. And typically you shouldn't feel anything when you're having your procedure done. Second, with the advent of better instruments, we are able to perform procedures much more effectively and efficiently so that they can be done quickly and done very well. My team focuses on the patient experience, and we want to create the best patient experience possible. We do that in different ways. First is empathy, active listening, and education. We want to show that we care about the patient. We just don't care about your teeth. We care about you as a person. And we want to listen to what your needs are. What are your goals? How can we help you? Let's partner together so that we can come up with a great outcome. And we want to educate you too. We want to make sure that you understand exactly what is happening in your mouth and how to fix it so that you can make the best informed decision possible. We encounter preventative care every day with patients coming in for their cleanings and their exams. We can detect cavities at such an early stage that we can quite often treat them before bigger work like crowns and root canals are necessary. And so what we end up doing is really saving the patient from needing to see us more often and to treat things at the earliest stage so that bigger work and more invasive work isn't necessary. Well, the name of my office is Complete Comfort Dental, which kind of summarizes what we try to aim for. We want you to have the best patient experience possible. We believe that if you have a great experience, you will not only be a patient for life, but you'll come in on a regular basis so that we can treat you when things are at its earliest stages, or we can prevent you from forming worse diseases in your mouth. And so we truly care about you as a person and as a patient. And we want you to become our patient for life.